Malaysia's daily COVID-19 cases have also hit an all-time high. More than 17,400 infections have been recorded, just days before the country's state of emergency is due to expire. Authorities have warned that cases will continue to rise as more people are being encouraged to use self-test kits. The surge has crippled the medical system. Hospitals are overloaded with a record number of critically ill patients. They're facing an acute shortage of beds in the intensive care units as well. Manpower is also an issue. Melissa Goh has more on how Malaysia is battling this worsening crisis.
As members of parliament continue to bicker over the government's failure to rein in the pandemic, frontliners are fed up. Burnt out by the surge in number of cases, many are calling for primary caregivers, general practitioners and even medical students to be all hands on deck to save the people.
We need help from the peripheries, from the primary healthcare centres, better screening.
Over 1 million have been infected with the virus and more than 8,000 have died. In just the past week alone, some 1,000 deaths were reported. The number of COVID-19 fatalities began multiplying in April, and the figure is projected to rise further in tandem with the surging number of daily infections. 70% of new cases are now recorded in densely populated Klang Valley, where hospitals are said to be in desperate need of at least another 800 beds in intensive care units.
This is alarming and it places a tremendous strain on our beds, our oxygen and our manpower capacity. Our top priority now is to save lives, to ensure that all ill patients get care. We have to continue to prepare for exponential rise of cases until we are fully protected by the vaccination.
Mass vaccination seems to be the way out of the pandemic. About 500,000 doses are being administered each day. The government aims to give all 6.1 million population in Klang Valley at least one dose of vaccine by August 1st. It hopes Malaysians will be able to safely exit the pandemic when all its adult population are fully vaccinated by October.
There are only two things which save life in COVID. Number one is steroid. Number two is oxygen. And it will be a pity for people to die because they don't have oxygen in time. Klang Valley, every hospital is crying out for oxygen concentrator. These are stopgap measures. It just shows that how serious the situation is.
Volunteer Dr. Ahmad Munawar Helmi from medical NGO Imarat said the shortage of beds in the government hospitals have spilled over to the COVID-19 assessment centres.
Currently, we are seeing the ones who are younger, no underlying medical illness. They come in probably at day 3, 4, but it's really at a critical stage. Most of the centres, we do have oxygen. It's just that patients keep coming. Team on the ground, they want to focus on treating the patients. But if a soldier do not have the weapons to fight in the war, then it will be really tough for them.
Fortunately, the public, including corporate donors and charity organizations, it said, have chipped in to extend a lifeline with oxygen tanks and concentrators. The Health Ministry is racing against time to add more beds in intensive care units by temporarily transferring non-COVID patients to private hospitals. Now, while oxygen saves lives, many anxious Malaysians are alarmed by the rising death toll, have resorted to stocking up oxygen cylinders like these at home. But doctors have warned against inhaling oxygen without medical supervision, as too much oxygen can damage the lungs. Melissa Goh, CNA, Kuala Lumpur.